ahead and get started because I know evenings are crazy for everybody. So, so I'm just gonna introduce myself. My name is Erin Santos, and I'm the executive director of the Isabella Santos Foundation and Isabella's mom, and Grant and Sophia's mom too. But I want to thank everybody for joining tonight. We're so excited to have Javier and Giselle on with us tonight. I know that when Giselle came on in July, we were in the midst of COVID. So for some of you, this is the first time you're actually able to kind of see her live without a picture from Levine's or something. She's like live and moving tonight. So we're super excited to have her on. I know that a lot of you have seen that last year was a great year for us. We were able to give away $1 million for the first time ever, with the majority of that going to these two great people in your screen today. So we're so excited about what they're going to update you guys on. I do want to take a second and thank Lake Norman, Chrysler, Dodge, Jeep, and Ram for sponsoring this Zoom tonight. They're actually going to be the presenting sponsor, or one of the presenting sponsors, at our upcoming Luminary event that we'll talk about in just a little bit. So over the next 30 minutes, if you have a question for Dr. Sholler or Dr. Oesterheld, go ahead and put it in the chat and we'll save those for the end. But in the meantime, I'm going to turn it over to them and let you guys kind of introduce yourself and tell us a little bit about what's going on with the program.
I really appreciate it, Erin. Thank you. So I'm Javier Oesterheld. I'm the chief of the division for cancer and blood at Levine Children's, and really excited to be on today and kind of go through our Isabella Santos Foundation Rare and Solid Tumor Program. As you can tell, we are together. We thought it'd be easier seeing both of us so we could answer. So it's been a whirlwind 6 to 7 months. You know, Dr. Sholler joined us in July from Helen DeVos Children's Hospital and brought with her a lot of patients, which is really exciting. So a lot of neuroblastoma patients, inclusive of now bringing on some sarcoma patients. And so we've been really kind of jumping nationally and internationally. We've had approximately 45 to 50 patients join our program since July. Some following Dr. Sholler from Helen DeVos, and then many of those actually are brand new to our system and brand new to the ISF Rare and Solid Tumor Program, which has been incredibly exciting for us. We've been able to bring some novel clinical trials, things that are only available here nationally. And Dr. Sholler will talk a little bit about the trials that she has opened here. It's been pretty incredible. We've opened about 3 or 4 clinical trials in the span of about 6 months. And so really, Dr. Sholler is the star of the show, and so I will. So this is obviously Dr. Sholler next to me. So she is an incredible doc who's worked her entire career in making sure that we are bringing new and novel therapies to our children. Specialties in neuroblastoma. Obviously, she does see some brain tumors, which I'll let her to describe. And she is the chair of the Beat Childhood Cancer Research Consortium, as well as the endowed chair for the Isabella Santos Foundation Rare and Solid Tumor Program. And we are over the moon to have her here in Charlotte, and everything that she promised she has achieved. And she is also the principal investigator in our pediatric cancer lab, better known as the Sholler lab here. And she'll talk a little bit about that. So Giselle.
Great, thank you. And thank you, Erin, for inviting us to chat with your group tonight. I'm so excited and proud and honored to be the Isabella Santos Foundation Director of the Solid Tumor Clinic here at Atrium and Levine Children's. It's been a great 6 months. I can't believe how much, with Dr. Oesterheld's vision of bringing this and creating and expanding the solid tumor program here, it's been wonderful to become part of the program. We, in coming here, brought the Beat Childhood Cancer Research Consortium headquarters as well, and our leadership of that has kind of been enmeshed into the Levine Cancer Institute, which we're thankful for in terms of the regulatory oversight and monitoring of all our clinical trials. We now have over 50 hospitals that are part of our clinical trial consortium. Most recently, Duke has just joined, and we're really excited about that and sharing in North Carolina some of the work that we're doing. Our clinical trials through the Beat Childhood Cancer continue to expand. We have our current trials for upfront neuroblastoma, but we've just recently, this week actually, opened a new study here for using DFMO as maintenance therapy in high-risk medulloblastoma, so in a brain cancer as well. We have a couple of new trials that we're really excited about coming up this year, and so that's we're one of them. We're collaborating with the University of Florida, combining precision medicine and immunotherapy, which we'll talk about in a little bit. And as the trials continue to expand, we continue to as well collaborate with other consortiums, with the Sunshine Project, bringing those trials into the solid tumor clinic, focusing on the MIBG and expanding that to patients as well. So we really want to bring, and I know Dr. Oesterheld says this a lot, all of the therapies that children need right here to children in Charlotte, so that kids from Charlotte don't have to go anywhere else. And I think we're getting closer and closer to making that happen. Actually, in 3 weeks, we will be giving the first 3F8 antibody here, which is an antibody that was developed at Sloan Kettering and has been there. A lot of families have gone there to receive that therapy. And in 3 weeks, we'll be using that therapy for the first time here in Charlotte. So we're super excited about that as well and collaborating with them. And then in addition, over the last 6 months, we built a whole new lab. Dr. Oesterheld made that happen in the Cannon Research Building here at Atrium Health. It's 3 laboratories that are going to be doing pediatric cancer research. And we're really excited about that. We have our lab manager and 2 lab technicians hired. We have research scientists that I'm interviewing next week, and then 2 other research technicians that will be coming into the lab. So that will be studying new cancers, new drugs to create into phase 1 for 2 trials to then bring forward to the consortium. Also, over the last month, we also opened our new Levine Children's Hospital biology study, where any child diagnosed here will have their tumor collected, brought to our lab for us to generate cell lines for that patient, mice models for that patient, as well as genomic sequencing, whole exome, as well as RNA sequencing. Every child diagnosed here with a new pediatric cancer. And then at every relapse, we're going to resequence those tumors. We've already learned that tumors change over time. And it's really important to follow those and to build a precision medicine program. And so that precision medicine program is one of the reasons that a lot of families from other countries and across the United States are coming here to Charlotte to have access to that. As Dr. Oesterheld mentioned, we've had 40 kids this year coming to Charlotte to become part of this program. So that's a lot. I'm just really excited about what we've already done and what we can do together in the future. Being here, I think that there is just so much momentum with the Isabella Santos Foundation and the whole clinical and research team here at Levine Children's that I'm excited to see what's going to happen this next year. And I'll pass that back to Erin.
Great. Thank you guys so much. I know for me personally, for any of you that have followed our story, you saw that we had to travel quite a bit when Isabella was diagnosed to Sloan Kettering to get 3F8. We traveled to CHOP to have MIBG. So it's exciting to think that since our journey started, I guess back in 2007, that today we never would have had to have leave, and all of those things are available here due to a lot of our donors. So I'm going to thank you guys for being a part of that. It's so exciting to hear everything that they have going on. We have new events that are coming up. I know that with COVID and everything, we're still very scared to kind of get some events on the books. But the one thing that we are focusing on next is on March 9th. It's crazy to think that Isabella would have been 16 years old. We were trying to figure out how to honor her in a way. Of course, pre-COVID, we usually do our coffee for a cure, but with that not happening, we were trying to figure out a very great, more sentimental way to honor her. So we have decided we're working with Calvary, which is down in, I guess, Pineville, Ballantyne, where Isabella actually went to preschool. It was actually where she was when she was first diagnosed with neuroblastoma. We had a great community that supported us there. And after she passed away, we actually had her funeral there, and she's actually laid to rest at Calvary. They've been really great, and we've reached out to them to ask if we would be able to do an honorary Sweet 16 luminary event there on the front lawn. So Dr. Monroe agreed. He was so great to let us do that. And so we have reached out to the auto community here in Charlotte, and I've been blown away. We have almost $50,000 in sponsors. About 90% of that is the auto community that has really come behind us for this event to make this event possible. The great thing about this event is that it again has very little expense to it. So probably almost 100% of what we're going to be able to raise is going to go back. And I'm going to have Giselle and Javier talk about what we're going to be raising the money for. But it will be on March 9th in the evening. You can purchase luminaries if you go to the IsabellaSantosFoundation.com. You can purchase luminaries for $25 each, all the way up to $5,000 worth of luminaries if you want. We offer another great thing called a family sponsorship that if any of you would like to be a part of. for $1,000 to become a family sponsor of our event. So we'll be placing the luminaries on the lawn with your names on them, with lights in them at night, and then we'll be leaving them lit all night and taking them down in the morning. But I felt like this is a really good event for us to do. Her birthday is always hard for me year after year, and I find myself thinking I'm going to do great and hoping I don't have to be speaking at an event. So luckily this year, it's a great way for me to kind of have a special day about her and not really be too much on display. And I just think that the idea of having luminaries out there where on a place where she was known and loved will just be so special for her. So one of the things that we're going to be raising money for is a specific neuroblastoma trial. And Giselle, I'd love to pass it back to you to see if you could kind of explain that in a little bit more detail. But we'd love if any of you would like to get involved. We've had a great outpouring of support, not just from sponsors, but from individuals. And I love kind of seeing all of the luminaries being purchased and the dedications. The dedications will also be on our website. There will be a scrolling piece on the side of our website where you can go out and see luminaries that have been purchased and who they're dedicated for. So to buy them for Isabella or someone you know that has been fighting cancer or has lost their battle, it's just a great way to honor them. And I'm so excited about what the funds are going to be going towards. So Giselle, do you mind chatting about that a little bit?
Sure. This is an incredibly exciting study that we're really looking forward to opening. This is a study where children with either relapsed neuroblastoma or DIPG, so it's really a group of foundations coming together to fund this to provide these children with the opportunity to have both precision medicine and immunotherapy occurring from their patient's tumor biopsy, their daughter, son's tumor biopsy. So as a patient presents with either upfront DIPG or relapsed neuroblastoma, a tumor biopsy will occur. With that biopsy, we're going to share the biopsy between our group and the group at the University of Florida under Dr. Mitchell. Our group will do the DNA exome sequencing, RNA sequencing to really understand biologically what is happening within the tumor, have a molecular tumor board where we look at all of the pathways that are active in the tumor to identify what drugs might specifically target their child's cancer. And we'll be treating them with precision medicine targeted therapy. At the same time, that biopsy also will go to Dr. Mitchell's lab down in the University of Florida, Gainesville, where he has been over the last 10 years developing dendritic cell vaccine and activated T lymphocytes to use the patient's own immune system to target their cancer. So the dendritic cells are cells, part of the immune system, that if he takes a piece of the RNA of the patient's tumor, inserts that into the patient's own dendritic cells, so we'll be doing a leukapheresis and collecting the patient's own white cells from their immune system. Their dendritic cells will then activate and present the antigen of the tumor to the patient's own immune system. So after the targeted therapy, patients will start to receive their own dendritic cells vaccine. That the dendritic cells is a small injection just under the skin. And they'll go into the immune system and activate the patient's immune system against the cancer. They'll receive 3 dendritic cell vaccines, and then we'll do another harvest of the patient's T cells. These T cells have then been primed by by the dendritic cells. They'll get further activated in Dr. Mitchell's laboratory, and the patient's T cells, and the patients will continue to receive 2 more dendritic cell vaccines, and then the autologous T cells. And now in providing in giving the patient their T cells back, first they'll receive a preparative regimen of cyclophosphamide fludarabine, which removes the naive T cells in their immune system, and then they'll get some stem cells back, and then they get the activated T cells, and these activated T cells can then go to the cancer as natural killer cells and kill the cancer cells. So it's a kind of combination. Many of our patients currently have to choose. Do we want to do precision medicine with genomics, or do we want to go on an immunotherapy trial? And when you only have, especially for a DIPG, one chance at that biopsy, we want to do the most we can for those patients with that one biopsy. So again, by splitting it, they can get their precision medicine. We can learn all the genomics of their patient's tumor, and then follow that up with the immune system hopefully clearing the rest of the tumor. At the same time, there's a lot of research going on in that trial. The cells will also be coming to our lab to grow cell lines for that patient and mouse models of that patient, so we can further study the patient's tumor in the lab as well, but that's on the research side. But clinically, they'll receive the precision medicine as well as immunotherapy. So it's a pilot study that's only going to be available here at Levine Children's and at the University of Florida. The rest of our Beat Childhood Cancer Consortium is very excited about it and really wants to participate in this study, but we're going to initiate it with 12 DIPG and 12 neuroblastoma, and the neuroblastoma patients will be funded, supported through the Isabella Santos Foundation. So we're incredibly thankful for that, and I know the families are as well, to have that opportunity for their kids. Once we get through the pilot study, we then plan to expand it out to the rest of the consortium, but for initially it'll be just here at Charlotte and in Florida.
Pretty incredible.
Do you guys get all that?
That was really sciencey, I thought.
I swear, she talks and I'm like, I know it's all good stuff. So it's really exciting. And I love how exciting she is, like when she talks about it. So, so we're super happy to be involved in it. I love that it's going to be out of Charlotte. That's always what we wanted, is to be supporting more new advanced therapies here in Charlotte. So that's what all of the funds for the Luminary event is going to go towards. So I was going to ask if you guys had some any like great stories of patients that you've seen, or new things that have happened here at the Rare and Solid Tumor program that you guys could possibly share. I know that of course there always had these HIPAA violations or whatever, but just any good general stories that you could share with everybody and talk about how great the program is going and some of the family successes that you're seeing.
I'll share a cute story just before she starts. Because they're all her patients anyway. I'm just teasing. Some of them are mine. But I saw a patient from England earlier in this week, and she's on our DFMO study and doing great with no evidence of disease. And so she's been, as many people know, battered through the chemo and everything else, and has never had really an immune system. And so she's 8, 9 years old. And all she really wanted, I went through all the medicine with the parents and everything else, and she just looked at me from England, which is kind of adorable, great accent, and then looks at me and goes, "Can I get my ears pierced?" And it was all that she wanted. It was adorable. And this was on Monday, and we saw her this morning, and she got her ears pierced at the mall, and it was her just smile from ear to ear. And I think DFMO allowing those in this simple trial, which is not so simple, but the simple trial to allow patients like her that probably wouldn't be here today is pretty incredible. Just the sheer joy of someone getting their ears pierced, which obviously I don't understand, but obviously a big deal, I think is amazing. And then Giselle obviously has 1,000 stories, but just to watch their excitement, one, to come to Charlotte, two, to be with this team that ISF has put together with Giselle is pretty awe-inspiring, because we have a huge team taking care of these patients, and they are getting the red carpet treatment, and they are all incredibly, I don't know, honored is not the wrong choice of words, I can't think of the right word, but they are proud to be here and proud to be on our clinical trials and everything else. But
Javier, could you give a little bit of a layman's terms of kind of what DFMO is? Because I know that's one of, well, I guess Giselle, that's actually one of your big things to let people know.
Yeah. I like being put on the spot. Yeah, so DFMO is something called a polyamine inhibitor. And so what all that means in layman's term is I like to just think of it as building blocks. And so without those building blocks, you can't actually make a cancer stem cell. And so it kind of keeps going. So what we do for neuroblastoma and Giselle's clinical trials have been to use it up front, use it in your therapy. So you finish, you go through lots and lots of chemo. And this drug is given twice a day. It's incredibly well tolerated. We give it as maintenance therapy for 2 years. We have it in combination with some other drugs for patients who aren't fully in remission. And so there are different trials for that. The DFMO really inhibits the stem cell from being able to continue to populate, because or to continue to grow. We think, at least Giselle's hypothesis, I don't want to say we, that's not fair, but Giselle's hypothesis, I have been here since the beginning, but Giselle's hypothesis is that that cancer stem cell, as it dies slowly with polyamine inhibition, will not be able to continue to copy itself, and eventually it'll burn itself out. And the data has been really clear from the preliminary studies. We just published that again last year, that there is about a 15 to 20% survival benefit with the use of DFMO in high-risk neuroblastoma, which for those people who understand high-risk neuroblastoma, 20% is pretty incredible. So
yeah, I think anything offering to kids to keep them from relapsing, because once you relapse, I know the survivor rate goes down a lot. So DFMO is a great advancement for kids with neuroblastoma. So I'm so glad that it's implementing here quite a bit in Charlotte.
Yeah, and I just a quick, it's funny to say that the DFMO has been in maintenance since 2000. It's been around for a while in Giselle's work.
Yeah.
And now lots of other tumors are starting to have maintenance in their tumors. And so I do think that BCC and Giselle's work has really been ahead of the curve, and we've been really proud to bring that here.
Yeah.
Giselle, do you have any great stories of families or some things that are happening in the program?
Yeah, so we have one little boy that from Eastern Europe, then through Germany, and then relapsed. Initially wanted to get on DFMO, but relapsed before getting here. And their goal was to get on DFMO. They ended up coming here from Germany. We treated him with chemotherapy first to get his disease back under control. And the family was so thankful to be here, so thankful to get back to close to in remission, enough that we were able to start our new study with DFMO and etoposide for relapsed neuroblastoma. And he has just done incredible. He's gone back to Germany for the in-between cycles, and we've just watched his tumor markers. There's a marker in the urine called VMA that we follow to see how children with neuroblastoma are doing. And just the last one, they're normal. And it's just so exciting to, his mother is so thankful to have had the opportunity to be here. I think you may have met her. I think she might have been one of your stories, but they're coming back in a few weeks, and they've done 3 months of this, and the numbers just keep dropping. And it's just so exciting because they're so hopeful that this is what, he needed. And so his scans, I think, are next week, and we're excited to see them back here.
And how is COVID affecting the travel for a lot of these patients?
It's annoying.
Yeah, it's the regulations just changed again. Our global health office here is incredible. They have, I've never had that type of service for our patients, but the amount of work they do with the embassies and the visas and the letters of necessity and getting the patients coordinated to get here. Now, currently for Atrium Health, we have to have, to get into the United States, patients have to have a COVID test prior to coming, and then they come in, and then they have to have 3 days of quarantine, and then another negative COVID test, and then we can see them in clinic. And our global health office is just coordinating all of that for the patients. They're making sure they get here, they get them to the hotel, they get their second COVID test, they can get to the Ronald McDonald House after that. They are making sure that our families can get here. We did have one patient that was on their way from South Africa, had landed in Qatar last weekend, and the Qatar sent them back to South Africa. So they weren't able to get here, but we did figure out a way to send DFMO there, and we are making it work with a virtual visit. So, we'll do whatever we need to make it work for the families. It's definitely a challenge.
I bet. What is the status of the MIBG room? Because I know a lot of people on this call were a big donors in making that happen. So can you give us an update on MIBG?
Yeah, of course. That one is actually me. Thank goodness I get to ask a question. We had our busiest year last year, actually, even through COVID. We became a COG site for the upfront COG study. We treated 2 patients on that, and we're still one of the very few sites in the US. There's only about 12 to 13 sites that are COG approved, which we're one of. We've been working on running different clinical trials. We work with the company that actually makes the drug, and we're able to tweak their most recent study based on our population to make it stronger and better. That was actually a really nice accolade for what the room is and everything else. And so we probably had 3 or 4 referrals already in January. A couple of them, unfortunately, aren't able to come for multiple reasons. And so evaluating a patient from St. Louis in the next week. And so the consults keep coming in, which is great. The expectation is to try and see 1 a month, which is pretty incredible. And I think with Giselle's work, I think is just going to grow. And I think coming back to the COVID comment, I think COVID has slowed us down. And even though I think if our team moved any faster, we'd probably lose it a little bit. So we're happy COVID kind of put the brakes on, to be very honest, a little bit. 45 patients in 6 months.
What the program was doing without COVID.
I'd actually be, and Giselle knows this, so I'm not saying anything she doesn't. I would be terrified to know what it would do without COVID. And so we're, not that we, and no one wants COVID, obviously, but I think for us, it has allowed us to ease into this as much, and it's incredible how, you know, we have more international families than national families, which I think is pretty outstanding.
Yeah. I mean, I would say for the MIBG, one of the families that did come for DFMO ended up having disease, and it was MIBG that was able to get that patient then clear, and now the patient is on DFMO. So it's a great synergy. It's just
there's a good story.
Yeah, it's wonderful to have
Here.
all of that to offer to the kids to get them where they need to be.
And that child actually ended up going on DFMO now, and so it's pretty
Perfect.
cyclical.
I love it's like a one-stop shop, which is what we wanted Charlotte to be.
That is, you know, that's always been our dream here. So we're happy to have accomplished it.
We have a question from Donna. Donna Reed, she's one of our big supporters at our race. She lives in Albemarle and has also a personal connection to Ewingsarcoma. So she wanted to know, what trials do you have planned in the area of Ewingsarcoma? Also, are you familiar with the particular subtype of BBCOR/Ewings-like sarcoma?
Yes to both. I am very familiar with it. And so I am definitely one of the sarcoma docs here. And so I think from a Ewing's perspective, you know, the precision medicine trial that Giselle brought up earlier, which is taking the tumor and I'm not as sciencey as her, so I'll dumb it down to my level, is we're growing it in a Petri dish, and then we're going to try eventually to put it back in mice and do lots of experiments on it, which is incredibly cool. If you have Ewingsarcoma and we can actually try things on your tumor, it's pretty incredible. Obviously in vitro or in the mouse and in the Petri dish work differently than in humans, as you would expect. You know, for us, I think in the Ewingsarcoma space, I think maintenance is also going to be very attractive in that space. COG is working a little bit on that. They've picked a drug that they think is going to be the right one. We have a drug that we're thinking about utilizing in Ewingsarcoma for trying to build it out as a phase 1, just from a volume perspective. So we're very engaged in sarcoma work. I think the Ewings, especially metastatic patients, unfortunately, are a very difficult population. They all tend to recur, and we want to work really, really hard with that. But our expectation in the next 6 to 12 months is to have a phase 1 up and running study with our younger colleague, Dr. Trevelyan, who came from San Diego, who's really working hard on our sarcoma work. And so hopefully more to come on that.
And that will apply to relapse patients as well?
It will be, that patient population will only be relapsed. We have a drug that Giselle and I are working on trying to get into the patient's hands. And so it's for adults right now, but we definitely think it's going to be working really hard for Ewings. And always nice to have 3 docs that think like-minded about clinical trials, trying to write that. And so that's just in our brains right now, but hopefully getting on paper soon.
Awesome. We also have a question from Charlotte. Charlotte was on our ISF board. So she said, with the influx of patients from all over the world, what are the implications for those families to get settled into Charlotte? Any partnership needs with the city/community to facilitate the acclimation?
Yeah. And there's always
I think
support needed. We have some families that are here now for a long time. One family who's here from China is here for 6 months because the Chinese government doesn't allow medical records to go back and forth. And so they have to stay here for the whole treatment. And then they'll come back. You know, I think they've already have connected somewhat to the community, but there are other families that are here. The ones especially that there are families that come for a week and go back, like our families from the one here from England this week, but other families that are here for a few months. I mean, they definitely, you know, it would just be wonderful to engage them in the community. And
yeah, and I think from my perspective, Global Health that Giselle brought up is a group within Atrium that is fairly new. And it's bringing patients into, and so they link you to hotels, to food vendors and things like that. And so there's always a need, especially for our population, because that national population it still needs obviously housing and needs to fly in and all that stuff. And so desperate for more hotel partnerships and things like that. So obviously always willing to discuss that. I'll give you a perfect example. One of our families moved from Wisconsin here, and we were able to get them a condo for 6 months through a community organization, which was pretty incredible. That was really hard to do because they were going to be living out of a hotel for, 6 months, which is pretty amazing.
And definitely, if you guys have those families that are in need, we do have the Live My Dreams side of our mission. We've been trying to work with Ronald McDonald House to really try to take some of the patients from the Rare and Solid Tumor Program under our wing and help provide them with additional items. So we're trying to talk to the Ronald McDonald House about that now. But if you do have families that need something outside of the Ronald McDonald House, a longer stay, please keep us in mind and connect us, with your social worker or whatever, and we'd be happy to talk about that.
Absolutely.
So we have
wonderful.
Yeah, and as you well know, we are recruiting for a social worker for this program specifically with the funds
we're
donated.
raising money for it right now.
Yes, for the funds donated, and so we are putting that in through our committees to get approved, and hopefully we'll have someone there, and so that will be a really important piece for that social worker.
So a great partnership with you guys.
Yeah,
Okay,
so thank
that'd
you.
be great. And then I guess, how is the hiring going with, I know that we just gave you guys the funds in December, but how is the hiring going for a lot of those things? I know we have some 3Wish members on for the clinic coordinator, which I know has already been hired, and she's there working, which we'd love to eventually meet her in person when this all ends. But some of the other things that we're going to be hiring, how is that going?
Yeah, so I guess we probably should have started the call by saying thank you for the generous donation last year. It was pretty incredible, especially through COVID. So obviously our hats are off to you and your team. But I think the reality is we just submitted all of the the process, the paperwork to start recruiting for it, and kind of tweaking that. So my expectation, honestly, is to have most of those positions filled in the next, my hope is 60 to 90 days. Those positions are a little easier to fill than physicians and advanced practice providers. We're also going to look for a solid tumor advanced practice provider to add another either PA or nurse practitioner for the clinic. That one will probably be summertime just because of COVID and interviewing. And we were lucky enough to hire Dr. Trevelyan virtually. I don't think we're going to strike gold twice. So I will probably hold that till COVID is a little bit in the rear view.
Great. And then just a general question, Giselle, I know that you're coming from Grand Rapids, Michigan. What do you think of Charlotte?
I love it. It's great. I love the city. The restaurants here are so much better than Grand Rapids, and I love the food. So yeah, it's been terrific getting to know the city, and yeah, I look forward to getting to know even more when we can really start to get out and see music and all that kind of stuff. But yeah,
it opens up a little bit more, it'll be great. And we'd love to have you at some events and have you meet some of these donors, because I know that our donors are so special to us because they just really feel a connection to the doctors and the program. So having them be around you will be only help grow.
I'm really looking forward to getting to know more people in the community. I had the opportunity to meet you and Maitland and Rachel and some of the people, but I'm really looking forward to meeting more community members and getting engaged in the community here in Charlotte.
Great. Well, I know we're 2 minutes over, so I'm going to let everyone get back to their evening. I'm sure Javier's got a bourbon drink sitting right in front of him that he's waiting to.
Right here.
So thank you so much.
Thank you.
On behalf of all of us, we're so impressed with everything that you guys have been doing, how quickly the program has grown. We're just blown away by it. So, and thank you to all of our donors who have been on here. One more question. I think they see, Diana, Max's mom said no question, but as a parent of a neuroblastoma child, I want to say thank you for DFMO and Dr. Sholler for fighting for that trial. So I love that.
Hi, Diana.
Love that there's patients on here that are benefiting from the science and everything. So we're so proud to have you guys a part of what we're doing here in Charlotte. So please keep us informed as much as we can. We'd love to maybe even do these once a quarter to kind of see if we can just
I would be happy to.
Yeah,
up and educate it. It's only going to help us to have our donors know what their money is going to. So unless anyone has any other questions, let me just see. I think it's just a lot of thank yous. Just thank yous. So anyway, so I hope you guys enjoy your night. Keep up the good fight and keep us up to date on anything that's going on. And then for all the people that are on the call, we have this recorded. We will be sharing it. Let's see. I feel like someone said there's something in. Oh, sorry. Matt Yarmy,
I'm reading it.
Board. Let's see. He said, will any of this data ever become publicly available without kind of mentioning the patients with an intent of bringing on data? Jesus, Matt.
You are speaking Giselle's language, so go for it.
So we are publishing some of our sequencing data soon. And so we have an agreement with the NIH through dbGaP, and that's where all of the genomic data it gets put. So we'll be depositing actually close to 300 patients' genomic sequences into the dbGaP, which is publicly available. So data nerds can pull that and do all kinds of things with it. And yes, and so we expect to have about 4 publications this year based on our clinical trials. We've one of the good things about COVID was it gave us a little time to write. And so we're excited about that.
And we have, but I think just from the precision medicine program, that data will all be ours. And so we'll be able to mine that data with biostatisticians, which Giselle has 2 as part of her group already. And so it's pretty amazing, actually.
And then one other person asked, curious if there's a standard to measure the ultimate success of the ISF rare and solid tumor program, and what does that look like? We just want to make sure that we're supporting you to meet that goal.
Aaron's heard me say this 1,000 times. If I can go an entire 12 months with having nobody leave Charlotte for anything at all, that's a win. And we are very, very close. I think with 3 of 8 coming here now, I think that's the last little bit. And then we've got to do some CNS neuroblastoma work. But outside of that, I think that's a success. And then really is outside of Charlotte, people asking. Right? People asking who Levines are and who is ISF and all of these 2, that combination. For the people on the phone, I don't think you realize how different of a collaboration this is from the national standard. And that's what excites us about it. It's what excited Giselle to come here. It's a community giving back to its hospital and the hospital really taking off with that community support. I mean, it's that simple. We can't do it without you guys. And so that to me is our success. And my hope is that, 2022, we sit and we talk and we've accomplished that.
That's awesome. Well, great. Unless anyone has anything else, I'm gonna go ahead and wrap this up. But thank you everyone for joining tonight. And hopefully, as I said, we'll do more of these so we can kind of stay up to date on what's going on. But congratulations on the success of the program. And thanks for joining us tonight.
Thanks, everybody.
Thank you so much. I really appreciate it.
Everybody have a nice night.
Have a nice night. Bye-bye.